For healthcare grade televisions, the user experience is much different than it would be for a consumer grade television. At home, the owner of the television is also the primary user of the television. So the settings, the configuration, the channels they like to watch, the owner and the user are all the same. But in a hospital situation, the owner of the television is the hospital, but the user is the patient. So the owner is going to want to set up the television in a way that is appropriate for that configuration and for that location. And the patient really needs to be able to use it and have a good user experience. So there are several software features of a healthcare grade television that are going to be appropriate in the hospital space that don't make sense on a consumer TV. The primary one is that the configuration menus are all locked out for the patient. So once it's set, the TV cannot be changed. That's important because things like the channel map can be misconfigured if a patient could accidentally get into those menus and accidentally make changes. So another feature that we provide on healthcare grade televisions is the volume limiter. Not all televisions need to be able to go to max volume, and sometimes that can be an issue on a floor in a hospital with a lot of televisions. If they're all being turned up to a very loud volume, it can create a lot of ambient noise. So the hospital can then remedy that very easily by limiting the maximum volume.